Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kym Douglas. Well, today we have a very special episode for you in store. Have you ever wondered, what happens behind the scenes at a major hospital? Think like ER, St. Elsewhere, Grey's Anatomy. And have you ever wondered who is making all the top level decisions? Who's keeping the hospital running smoothly? And is hospital food the same everywhere? Well, we're about to find out, because on today's show, we're going to pivot, and instead of talking to doctors or patients, we're going to chat with Michael Ricks, who is the Chief Executive of Providence St. John's Health Center right here in Santa Monica, California. First off, I'm so glad you're here with us.
Thank you. Happy to be here.
We had to literally drag you in here, but
That's right.
It's
I got
okay.
a call 30 minutes ago. That's
all
good.
You're like our great guy to go to in case anybody can't make it. But more importantly, let's talk about your hand.
Yes, my hand. It gets a lot of attention nowadays.
Yes.
So I was arm wrestling, and no, I wasn't arm wrestling, but I was snowboarding in Utah.
Love it.
And of course, like every skiing or snowboarding injury, it happened on the last run of the day. We say, don't ever say it's the last run of the day, but did the last run of the day. And the crazy thing is there was snow in the parking lot. And so you could actually ski and snowboard all the way to your car if you wanted to.
Yeah.
So I needed a little bit of momentum. So I went off a jump between the resort and the parking lot. Got about 6 feet of air, which was amazing while I was in the air. Knew I had to land it, and I landed it, but unfortunately I landed on a bed of ice. And instantly the board went right out from under me, slammed me down. I have a little fracture in my sacrum and 4 fractures in my wrist. So
I know a great place that can take care of you.
Yes, it's amazing.
St. John's.
Yeah, actually, it's funny. I try to get injured. I don't try, but I usually get injured about once a year. So I'm a secret shopper in my own organization.
There you go. I love it. Well, let's start literally from the top. What does a chief executive of a hospital actually do?
Sometimes I get home each day and I ask myself, that question. I worked hard and I worked all day long, but what did I do? And so when people ask me that question, I usually answer it this way. One is I'm involved in 3 Ps, like the letter P. And then if you're lucky, there's a 4th P involved in that. So the first P is people. And so we're working with physicians and staff and other clinicians to make sure they have all the resources they need to do an amazing job taking care of patients. So that's number 1. Do that all day, every day. Number 2 is processes. So we're always involved in making sure that we're improving on the processes around clinical care, safety, experience, et cetera. Because again, we want our employees to be as happy as they can when they're at work, because then they give better care to our patients. So always looking at process improvement. Then the 3rd P is politics. Now there's internal politics, which we won't talk about right now, but every organization has it. But just as, if not more important, is external politics and policy. So how do we get involved? How does the CEO get involved in local, state, and federal politics and policy making in order to, move policy around healthcare, especially around the finance and reimbursement of healthcare? And then the last one I tell people, the 4th P, is that if you're lucky enough, you get to deal with philanthropy. And that's one of the amazing things we might talk a little bit more about at St. John's. But at St. John's, we live in this amazing community that gets fantastic care, and we have people that have the means and want to give back. So those are the 4 things: people, process, politics, and philanthropy that I do a little bit of every single day.
Oh, I love that. That sounds like a great job. How does one prepare to become a chief executive? Do you have medical training, and do you need that?
No, I do not. And that sometimes I feel like I'm in healthcare enough. Whenever someone's in the airplane and they say, "Is there a doctor or a clinician?" I literally have to make sure I don't raise my hand, because I feel like I'm in that environment all day, every day, but I'm not a trained clinician. But for a chief executive, there are clinicians that do make it up all the way to being a CEO, a physician, or sometimes a nurse. But most of them they're all master's prepared. And they're either a master of health administration or a master of business administration. And so you really have to learn kind of the business side of things in order to get prepared and do that. So you have a master's degree, and then you just go and you get experience. A lot of times, just like medical students, after they get done with their medical degree, they do a residency or a fellowship, which is to continue their training. Administrators are the same way. They go to graduate school, and then they oftentimes do an administrative residency or an administrative fellowship to give them that real world experience. And then after that, hopefully you've done enough to create value in the organization. And a lot of times you get hired on in that organization and you may be a supervisor. And then if you do well, you get to become a manager and maybe a vice president. You just kind of go and climb the career ladder, if you will.
Yeah, wonderful. So I know that you became chief executive at St. John's relatively soon, right before the pandemic.
Correct.
So I'm not sure if anyone could really have been prepared for that. But what was that like for you and for St. John's?
Yeah, it was probably the emotions on both ends of the spectrum, right? So it was on one side, it was like amazing. And what was amazing is to see people rally. I think that was the number one thing. Everybody kind of, there's a little bit of an overused term during the pandemic around, calling, healthcare workers heroes, but they really were. I mean, it was amazing to watch them. I was thinking this the other day about like our sick calls. Our sick calls were probably less during the pandemic than before or after, just because people really, really care. So it really brought out the best in people. And I think it also, though, was super taxing, super tiring. People were doing more with less. There was this kind of scariness around, what does it mean? Nobody knows. Do we have the right personal protective equipment? All of those kind of things. So it was, again, it was super, super scary. People worked really, really hard, but it was amazing to see people really rally, get closer together, and provide amazing care to our patients.
And how about the nurses and the doctors? And
yeah,
how did they?
They're true heroes. I mean, they're worn out. A lot of them, would work so hard. People working, multiple shifts back to back. Oftentimes working beyond their 12-hour shifts, and so they all rose to the occasion. I couldn't be more proud of St. John's and what we did. It's interesting. When we first had the pandemic, the very first wave, we took care of like 31 patients, which is not a ton.
No.
But we really thought the world was coming to an end. We just didn't know what this meant because there was so much conversation. It was so undefined. And then the second and third wave, I think it was the third wave that we had almost 100 patients in the hospital. Yet there was this thing we said, we got this. There was this confidence because we learned from the first and the second wave, and we're very, very prepared. And even though we had 3 times as many patients in that third wave, we had this sense of confidence that we knew what we were doing and we knew how best to take care of these patients. So it was pretty awesome to see everyone grow and learn and be educated after each wave.
That's so good. And it kind of leads me into this next question. And that's, how did healthcare and the delivery of healthcare change after the pandemic?
Yeah, for sure. I think that 3 things stand out on the prevention side. So one thing is PPE, personal protective equipment. That became, because no one knew whether this was airborne or whether it was droplet or kind of what it was, there was a lot of confusion. But bottom line is we knew we needed PPE. And as a country, we really weren't prepared for a pandemic. There wasn't enough PPE. And so being able to get PPE, it really kind of stressed the importance of we can help prevent people from getting this and spreading it by using masks. It's just as simple as surgical masks that are very, very common. I mean, the N95s were important and there was a use for that, but surgical masks went a long ways in being able to prevent the spread of the coronavirus. So that was number one, is we learned a lot about PPE. Second, we also, in healthcare, we've been stressing wash your hands for decades. And people just don't do it. Of course, they come out of the bathroom, they wash their hands, but beyond that, how do you wash your hands and so forth, and how long do you do it? And people just really ignored it. Well, all of a sudden, the pandemic, everybody's washing their hands. I mean, we didn't have enough gel, alcohol gel, et cetera, to wash your hands because people were just doing it all the time. So in a way, it was good because it finally got people washing their hands because they're like, you know what, I'll take 20 seconds, wash my hands, and maybe this will prevent me from getting COVID. So that was one thing. The third thing, I think, is the use of telemedicine. And so people were super anxious. They didn't want to go outside their homes. They were scared. Again, all this like information and misinformation that was out there. And so we were able to use telemedicine to do physician to patient visits. And that went a long, long way. So people could stay in the comfort of their own homes, the safety of their own homes, and our physicians could contact them. And it's amazing. So different types of virtual platforms got so much better. If you didn't need to have a physical examination, then it was definitely better than okay to actually have a virtual appointment with your physician. So those 3 things really were significant and changed a lot. And then I guess I would say the last thing is the pandemic obviously reinforced how important vaccinations are. And it's really, for me as a healthcare professional, it was disappointing that vaccinations got politicized. But the bottom line is we know vaccinations work. Not many people argue about chickenpox vaccination or even the flu vaccination, but there was all this craziness going around with COVID vaccination. And I think most of that has calmed down now, but vaccinations are real, they work, and it's important, and people are finally getting that. And I think they will understand and appreciate vaccinations moving forward.
Yeah. Now, what makes a hospital great?
What makes a great hospital great is the people that are in it, the people that spend all their time practicing. And we have amazing. I know every organization says this, but we really have amazing physicians, amazing nurses, amazing techs, amazing environmental service workers. I mean, whether people are cleaning dishes or preparing food, whether they're cleaning rooms, whether they're giving imaging exams, or whether they're physicians doing surgery. That's what makes hospitals great, is the people that are providing the care to our patients in this community.
I agree. And there's just such a family feel.
There is.
At your hospital. There really is. Everybody's so nice from
Thank you.
From the top on down. So there have been a lot of firsts in medicine that have happened here at St. John's. Can you tell our audience about some of the amazing accomplishments that are part of St. John's and the Cancer Institute's history? Yeah,
sure. So it's amazing. It's amazing history. I mean, since 1992. So in 1992, Dr. Donald L. Morton, one of the pioneers in surgical oncology, he actually brought the program from another organization here in the community to St. John's, and about 80 staff came with him. And so since 1992, we've been performing amazing research and clinical care in the field of oncology. Dr. Morton, he actually invented the sentinel node biopsy procedure. Now, in full transparency, he did that just before he came to St. John's, but he had the opportunity to perfect that at St. John's and the work that he does. And it's super helpful, especially in breast surgery, melanoma surgery. And so if you go on the internet and you say, you put in, who invented the sentinel node biopsy, you see Dr. Donald L. Morton. For him to spend the bulk of his career right here at St. John's is pretty amazing. We have other doctors like Dr. McKenna, who is a thoracic surgeon who invented. Did you interview him? Yeah. So he literally, he was probably pretty humble, but he literally invented video assisted thoracic surgery. So if you were to think, if you were to pull up a random country, the chances are that he was did the first video assisted thoracic surgery in that country. And he practices here, still going strong every single day. We have doctors like Dr. Andy Yun, who's an orthopedic surgeon, does hip and knee replacements and joint replacements. And he's the highest volume joint replacement doctor in the entire country, maybe the world, but for sure the entire country. And his outcomes are exceptional. And so we have he and a number of other orthopedic surgeons that practice here do great work. So a lot of amazing things led by our physicians. One last thing I would just throw out there, we have this amazing ECMO program. So ECMO is an acronym that stands, it's ECMO, and it stands for extracorporeal membrane oxygenation. Yeah, words you'd love to use in the game Scrabble.
Exactly.
That's for sure, right? But what it is, it's basically a technology and a piece of equipment that you get hooked up to when you're having advanced, very, very advanced heart failure or very advanced respiratory disease, and you're literally close to dying. And it's almost a last-ditch effort to save a patient's life. And what it does, you get hooked up to it, and it does the work of your lungs and your heart for you, and then your body, your organs just determine kind of on their own if they're going to regrow and heal from the damage that they've had from that heart failure or that heart disease or that was lung or pulmonary disease. And so during COVID, it's a lot of organizations, a lot of big, really only the university academic level centers have them. And St. John's actually took care of almost more COVID patients than any other hospital during COVID. In fact, we were featured in the New York Times on the front page for the ECMO program that we had. We had up to 9 patients at any given time in our ICU on ECMO. A lot of great organizations won't do more than 1 or 2 because of how high the acuity is, how many resources it takes, and we did up to 9 during COVID, and so saved a lot of lives that otherwise would have passed away for sure.
Wow, amazing. So St. John's has some very impressive service lines. Is that what you're talking about, or are there others that you can share a little about these areas of expertise?
Yeah, so I think that, cancer really, I think in 1992 kind of put St. John's on the map because of Dr. Donald L. Morton, and then many of the faculty that followed after him. I mean, they're top-notch luminary physicians that research and publish and then provide excellent clinical care. So our cancer service line was one of the first. In 2017, we established the Pacific Neuroscience Institute, which is neurosurgery, neurology, brain health, et cetera. You've probably had some of those people on here as well.
Yes.
A remarkable story about them is in 2021, they got ranked by U.S. News and World Report as number 49 in the country. Now, the reason that's amazing, so they were 1 above like Vanderbilt University. It's a big, massive organization, and that's what make up the top 50 are these academic university, medical centers. And to have Providence St. John's Health Center's P&I, Pacific Neuroscience Institute, in the top 50 was pretty amazing. So cancer, neurosciences, and then we launched our Women's Health and Wellness Institute in August of 2020, doing some great work there. And then in the spring of 2022, we actually launched our Digestive Health Institute and our Heart and Vascular Institute. You've probably had speakers here. And then we have an Orthopedics and Spine Institute. And then last but not least is we have a Behavioral Health Institute. So we have 7 institutes, and those institutes have clinical programs led by physicians and clinicians that are always trying to improve and provide that optimal experience for our patients in this community.
So great. Speaking of in this community, so you live nearby.
Correct.
I live just down the street. And just full disclosure, I think you know this, but I was treated for breast cancer here.
Right.
And 4 years clean and healthy.
Fantastic.
And feeling
Congratulations.
great. And
so happy.
Couldn't appreciate this facility
Love
in
that.
your hospital more.
And you know what? I got to tell you, it never gets old hearing
I
that.
know.
I get to
bet.
hear it a lot.
Yeah.
I tell people on the weekends when I interact with people, I feel like everybody was born in Santa Monica, St. John's, which obviously isn't true, but it feels that way.
Yeah.
I mean, everybody I talk to, they're like, my kids were born there, and everybody was born there, or they had orthopedic care, or they had cancer care. And so thank you for sharing that. I love that.
Feel really good. So not many community health centers do research. And what is St. John's doing, and how is it making an impact in our community and also beyond?
Yeah, so research is a couple of things. One is we have both translational research, and then we have clinical research. And so the clinical research all of it's amazing. And literally since Dr. Morton came here in 1992, we've been actively engaged in clinical trials. And we've had as many as 300 clinical trials at any given time with significant number of patients enrolled in that. And it's really changed the way cancer care is delivered. And now we've been doing more like in cardiac, women's, orthopedics, et cetera. So cancer is where we've started in doing research, but now we're doing research in our other institutes as well, which is terrific because that's what has to happen. I mean, luminary physicians, for them to actually come and want to work at a community hospital, they have to have a research mechanism for them to continue to be involved in those clinical trials, getting published, and doing different researches like that.
And one of the things that I know is true at St. John's is that part of its mission is to serve the community, especially those who are poor and vulnerable.
Absolutely.
And so can you share a bit about what St. John's is doing to bridge the gap in healthcare disparity?
Yeah, absolutely. I think unfortunately, one of the, we talk about a lot of great things that came from COVID, some silver linings, but one of the not so silver linings associated with that is we realize there truly is, disparity amongst different races and ethnicities for healthcare. And we had, it's very public that we took care of Chadwick Boseman here at the hospital. And his wife, Simone, has allowed us to be able to share, his story. And so for about his last 4 years of his life, we took care of Chadwick Boseman. And what's very interesting about that is when you take care of someone off and on throughout 4 years of their life, you can't help but bond with them. And Chad, I didn't know him personally. I got to meet him once, but I didn't know him personally. But it was amazing he was like, when I beat this disease, I want to partner with you, St. John's, in improving colorectal cancer, which was the disease he had, improving the screening in his communities, in his Black communities, especially with his Black brethren that seem to have significant lower screening rates. And so, unfortunately, when Chad passed away, we became even more emboldened to help, fulfill his legacy. So we talked to Simone, and we ended up being connected with Stand Up to Cancer. So between Stand Up to Cancer, Providence, our parent organization, and St. John's, we've created this amazing effort to go deep into these brown and Black communities in South LA and in Santa Monica with an effort to establish these relationships and partnerships with barbershops, pastors from congregations, schools, and other not-for-profits, and really find ways to get access to these individuals that haven't had their screening and be able to provide screenings for them, which no doubt will end up saving lives in these communities. So it's something that's pretty awesome. A lot of people talk about health inequity. It's kind of a buzzword, but rarely have I seen organizations like St. John's really actually doing something about it.
That is wonderful. So good to hear. I also know that there is an amazing plan for expansion in place for St. John's. So what can you tell us about the future of healthcare?
Yeah, the future of healthcare is very exciting. What's interesting when you hear about expansions, usually in the past when you heard about expansions, it was about adding beds.
Yeah.
And nowadays, there's probably enough beds in communities. Now, some of them may be old and they need to replace those beds, those rooms and so forth, and patient towers. But for the most part, whenever you hear about expansion now, it's not in the inpatient space. It's more in the ambulatory or outpatient space. So medicine has come such a long ways. There's still patients that are sick enough that they need to stay in your hospital, but we do probably 4 or 5 times as many patients where they come in, they get treated, and they're able to leave the same day, go home, et cetera, as opposed to stay. So most of the expansion nowadays is in the ambulatory or outpatient space and also in research. And so we've been working here at St. John's. We have what's kind of a phase 2 master plan, and a big part of that master plan is the development of our South Campus. So directly across from the health center from Santa Monica Boulevard, it's a little over 5 acres. And we, in April of last year, got approval from the Santa Monica City Council to actually develop that land. And so right now we're working, it could be probably about a $2 billion project. So we're looking for some partners, and we have some partners right now that we're entertaining conversations about what could we do? How could we expand healthcare access? How could we build on the amazing legacy we have around research and do something that's world-renowned right here in Santa Monica for this community?
I did not know that. That's very exciting.
Super exciting.
Wow. So I understand that Providence St. John's is a nonprofit organization. So what are the differences between for-profit and nonprofit healthcare systems?
Yeah, so both, I think both offer good care, that's for sure. But in the for-profit world, your response, you basically are trying to create, financial strength for stockholders, for people that own shares within your organization. And so that's what drives that organization. The leaders of that organization, if they don't, have amazing finances, then they get fired, right? And so here, that's not the case. We do need good finances. We have this theory or this motto that no margin, no mission. So it's super important to make a margin, but you want to make a margin so you can put that back into your organization. And that's what not-for-profits really do in healthcare is any money that we make, any profit that we make is actually put back into the organization or into the community via community programs. And so, I think that we've never really kind of figured out exactly what the dollar amount is, the advantage that we have of being, tax exempt or non-for-profit. We think it's somewhere maybe around, $8 million approximately. So we have this a benefit of not paying taxes on, let's say, $8 million. And so you should be required. It's not necessarily required, but it should be required to exceed that in what you do in the community. Well, here at St. John's, on average, we do about $50 million every single year in either free care, shortfall of Medi-Cal payments, and more importantly, community benefit programs focused on child and youth development, mental health, homelessness, et cetera. So to know that we do probably 7 times more than what we would be required to do is pretty amazing.
It sure is. And I know for sure, and most of our viewers and listeners do, that St. John's is blessed with many friends and supporters. So what role does philanthropy play in the health center?
Yeah, philanthropy is definitely, if you talk about, kind of secret sauce of organizations, philanthropy is definitely one of the secret sauce, one of the ingredients that makes up the secret sauce of St. John's. And so, in healthcare, reimbursement is not going up. It continues to go down. The cost of healthcare rise. And reimbursement continues to go down, and that creates significant strain on organizations. For an organization like St. John's to continue to thrive, in this community where cost of living is super high, right? So trying to get staff, pay them appropriately and so forth, the margins are razor thin, super thin. And so it's important that we rely on patients in this community that have had an amazing experience at St. John's, and they want to give back. And so many of our trustees that we have as part of our philanthropic foundation, they've received great care at St. John's, and they say, hey, I want to give back. And we'll give back, whatever that means, time, resources, money. And in this community, a lot of people have money, and they know that they can help us in significant ways, either replacing technology, replacing equipment like MRI machines, cath labs. But a lot of philanthropy as of late is being put into human capital. So how do we recruit and retain the world's best physicians, leaders, et cetera, here at St. John's? So we've been able to use philanthropy for human capital as well as physical capital and bricks and mortar. And we probably would not be anywhere near the prominence that we have here at St. John's without philanthropy and the support of our trustees, who are just amazing.
I'm certain of that. Well, now we're going to switch gears a little bit, and it's time to get a little personal about you. I do have a lightning round, but I'm going to go easy on you because you have a cast.
Because I'm injured.
Yeah, because you're injured. So
I'll take it.
There you go. So let's start out with this. What is your lifelong dream? Was it to become a CEO of a world-class hospital, or did you have something else in mind?
I thought I was going to be the next Ken Griffey Jr. Major League Baseball player.
Really? So you played
baseball, played a little bit in college, and then realized that my dad had been telling me all along that I wasn't that good. Early on when I was young, you're really, really good. And then as I got older and mature, you're not that good. So get your education and do something. And thankfully I followed him at some point in my college career and decided I needed to get serious about school. And I actually did an internship at a hospital. The CEO there actually knew my parents. I had no idea of that. He came into my office 2 days on the job and asked me if I knew who my parents were. And I said, yes, of course. And he said, what are you doing here? And I said, I have no idea. I'm just checking the box because I have to do an internship to graduate. And he's like, I know what you're doing now. And I'm like, what is that? He goes, you're working for me. And so I got to follow him around and see the impact that he had on one of the most valued assets in the community as a leader of it. And it was remarkable. And at that time, I knew that's what I wanted to do for my career.
Made the decision, divine appointment indeed. So not only are you a CEO, but you're also, as we see here, an Ironman. Tell us a little bit about your athletic life.
Yeah, I think people would question if I'm really an Ironman, right? Ironman's supposed to be strong, and I'm always injured. But yeah, I've actually done a couple of Ironmans. So Ironmans they push you, right? And so an Ironman competition, there's triathlons and then there's Ironmans. And Ironmans are running or swimming 2.4 miles and then coming out of the water and riding your bike 112 miles and getting off your bike and doing a marathon, 26.2 miles. So it stresses the body like no other. Training for it is great. For me, it's like an opportunity to keep balance, take care of that whole person. So, you work really hard, you do lots of long hours, but that exercise is critical and super important. And so I've done cycling events all around the world, done triathlons and Ironmans, and it keeps me a little bit sane. In fact, early on in my career, my kids told me, they said, Daddy, we love you even more when you get your exercise in. I was a little offended at first, but then I was like, wow, I have this amazing pass now to go get my exercise in. And it does, that's why, at the organization at St. John's, we try to create opportunities for people. The work they do is so serious and it's such a heavy burden. We try to create opportunities for them to breathe and relax and have fun and enjoy what they do as well.
Right. Well, what I love, you practice what you preach. And
Absolutely.
Truly, you're in great shape and you really do practice what you preach. So we do this little thing at the end of the show and we call it the takeaway. So if there was just one thing that our viewers should take from today's discussion, what would you want them to take away?
Yeah, I think I would want them to take away the vision that we have at St. John's. So we have the strategic vision, and the strategic vision is that we want to be that premier and preferred provider of healthcare in West LA. But the key is by doing it this way. We want to offer academic level care and research, but in a community hospital setting that's known for a personalized and exceptional experience. So we're committed at St. John's to this community of providing the highest level of care that you could find anywhere, and then making sure you have an amazing experience.
So I'm going to go off script. This is the last question. And I just wondered what you thought about, I forget the name. It's a podcast that they do through St. John's Healthcare Foundation, Your Healthy Dose with Kym Douglas. What do you think of that podcast?
I think the podcast is amazing, largely in part because we have such an amazing host who conducts that. It makes people feel at ease. And obviously you have a name and amazing reputation in this community as well. So I think people will sign in just to check that out. But it also is an amazing way to let people know about the amazing services that we provide at St. John's, both in this local community, but throughout the whole country, right? Because anybody could access this. And a lot of times people are willing to travel to get the best possible healthcare. So this podcast allows people, obviously in this community, but outside of this community, to know the amazing work that's done at St. John's, and that if they come to St. John's, they're going to get exceptional care by luminary world-class physicians.
Love that. It really, I do a lot of stuff in the media, and this really makes me feel good. So
Yes,
I want to
absolutely.
say thank you to our team, and thank you to you for allowing me the honor of doing this.
You're very welcome.
really
Thank you
mean
as
that.
well.
Well, I don't want to end this podcast. It was so great. So I guess that's all the time we have, unfortunately. And honestly, you are Michael Ricks, the maverick of this whole organization. You said it was your favorite movie. We know
Absolutely.
why, because
Yes.
you're our maverick. So
Oh, thank you,
you
Kym.
keep
Appreciate it.
soaring. I mean that. And thank you to St. John's Health Center Foundation for, of course, making this podcast possible, and the many friends of the foundation for making it possible as well. Now, we also want to thank all of you for joining us today. Be sure to tune into our future podcasts, because we have more medical experts from St. John's, and they join us to share their insights about a number of important topics. And if you missed any of the previous episodes, please visit yourhealthydose.org, and you can see them all there. I'm going to go talk to Maverick, and until next time, I'm Kym Douglas with Your Healthy Dose.